to give medications in an attempt to resuscitate Mr. Jackson.
Okay. So the endotracheal tube, how were you able to confirm that that was correctly placed?
By direct visualization.
Okay, and what is it that you would see?
You would put a blade, it's called a laryngoscope blade, and you directly look to see that the endotracheal tube is actually going through the vocal cords into the trachea.
Okay, and that's what you were able to confirm?
Yes.
Is that yes?
That's correct.
And did you utilize an ultrasound at that point?
We did early on use an ultrasound to examine the heart.
Okay, and can you explain that device and what the purpose of that was?
In the emergency department, we will frequently perform limited ultrasound. I guess the most common reason people think of an ultrasound is when you're doing sort of prenatal care and looking at a baby. It is a device that is used by cardiologists.
I'm having a little trouble hearing. Could you repeat that?
Yeah, I think most people would consider an ultrasound as what we look at when we're looking at a baby. It's different than an X-ray. It gives us information about the chambers of the heart. Cardiologists would perform an echo. They do echo, which is that type of ultrasound. It's much more detailed than the limited ultrasound that we perform in the emergency department.
Okay. Looking at what was marked People's 47, may we dim the lights, please, Your Honor?
Please.
Doctor, is this the actual trauma bay where you worked on Michael Jackson?
Yes.
I'm going to hand you this pointer. I'm sorry, you have one there. Could you use the pointer? And if you could just...
How do I... Oops, turn it on? Is it on? Oh, there we go. Okay.
Let's start to the leftmost part of the photograph. This appears to be a computer screen. Is that a keyboard?
That is a computer screen.
Okay, and what is that?
That is one of our computers that has, we have an electronic tracking system and computerized order entry, and the system is loaded on that computer. In addition, it has web access, and so that we can access medical records while we're in the resuscitation suite if we need to.
Okay. And then let me switch from People's 47 to People's 48. Looking closer to the corner of the room there, first of all, would this be the bed where Michael Jackson was placed?
Yes.
Okay. And what's the term for this?
It's a trauma gurney.
Okay. And describe for us what we see then in the photograph beyond the gurney, all of this medical equipment here.
This tool chest is our airway equipment.
And you've indicated the large tool chest with appears to be colored doors, white box.
Yes.
Is that where you're pointing?
Yes.
Okay. And what type of airway equipment is in there?
There are endotracheal tubes. There are other advanced airway devices. So if we were attempting to intubate a patient and we could not place an endotracheal tube, we have rescue airway devices.
Okay. And above this, the airway equipment, this monitor here, what is that?
That's the cardiac monitor the patient who is in the trauma room would be placed on.
Okay. And what type of readings would that give you?
That would have a EKG rhythm and sort of heart rate. It would have blood pressure. It would have the oxygen saturation. If the patient had an arterial line, as Mr. Jackson did, the pressure tracing would be connected and shown on the monitor.
Okay. And this would all, the readings that would be on this monitor would be from sensors and devices attached to the patient?
Correct.
In this area then, in the photograph, which would be to the right of the airway equipment and the monitoring screen, what is shown here?
There is, it's a little hard to see. The This is actually a portable monitor and defibrillator.
Okay. And you pointed, is that this,
Where you see the red and
okay, to the
it's
right of
in
the
a pack.
airway equipment?
Yes.
Okay.
And although it's not clear to see here, there's a ventilator here.
Okay. And then how about this device to the right of the defibrillator, this pole, and then a device on top?
Without seeing a close-up picture of it, I'm not sure if which part of our equipment this is.
Okay, let me see if I can. Are you able to tell, or is it too blurred?
It's a little bit blurred. I think this is one of our smaller ventilator devices and not our other airway device.
It's a smaller ventilator device?
I believe it's, there's an oxygen tank. I believe this is portable ventilator and this is a bag valve mask, but I would have to look at be in the room and look at it to
Okay.
be sure I'm not misspeaking. And
Okay. And going beyond that equipment, what is this cabinet here immediately to the right of that equipment?
this cabinet has several different trays, various equipment we would use in the resuscitation of a patient. This is a trauma bay, so there are tubes so that there are trays that we can crack a patient's chest open so that we can place tubes in people's chest. If we needed to do what's called a tracheostomy and sort of an airway where we went directly into the neck, that equipment is held here. There are central line kits, sort of type of IV kits that we will use.
When you said a tracheostomy, when you go straight into the neck, what is that exactly?
Instead of the endotracheal tube where we go through the mouth with a tube into the trachea, in some people that's not possible, and they will have an airway where we cut directly into the neck and place it. Emergency physicians typically will not put in a tracheostomy tube. That would be done by a head and neck surgeon, but we have the equipment here in case it's needed.
Okay, but that would be where you couldn't use an endotracheal tube, but you needed to ventilate?
Correct.
Okay. And then you mentioned at the bottom there, the equipment for a central line, is that what you said?
Correct.
And what's a central line?
A central line is, in essence, a larger and longer IV that allows us to access the central circulation quicker than would be a IV that was placed peripherally in an arm.
How is a central line put in place or administered?
So central lines are placed by the physicians. They are initially, it's what's we call the Seldinger technique.
The what?
There's a special technique that we use where we use a needle to puncture the vessel. We then introduce a wire and guide the wire through the needle into the vessel. We then introduce a catheter over the wire into the vessel.
Okay. And going then to the right, the equipment you've described, and I'm going to switch photographs as we move through the room. People's 49.
The emergency room doctor who was there when Michael Jackson was brought in, talking about what happened that fateful day. We're going to take a brief break. We'll be back with more testimony in just a moment.